Hi, my name is Morgan Colburn. I am a nursing policy 420 student for the summer of 2023. I chose to do my policy action plan assignment on insulin affordability, and this is my professional testimony for week 5. No person should ever have to choose between managing their health and affording food or water or housing for them or their children. I just don't think that that's right. If I was given that choice, manage your diabetes or afford food, I would choose food because that's a hierarchy of needs. And I think a lot of people don't realize how expensive insulin is. People can be on multiple different medications to control their diabetes, sometimes short-acting insulin and long-acting insulin, and each vial of insulin can cost $175 to $300 per vial, and depending on people's blood sugars and stuff like that, it could depend on how much they're taking, and that can equal out to nearly $1,000 a month. And that's on top of any other health problems someone can have and medications that they're paying for. And I just don't think that that's right. And the cost of living is so much more expensive than it used to be. So nothing's really getting better. And insulin prices are also increasing. The manufacturing market for insulin usually drives the prices. So they kind of set the prices, and then health insurance plans and stuff like that, they determine the coverage based on that. There's a lot of different programs available. You have Medicaid, Medicare, different health insurance companies. The Affordable Care Act has helped a lot of people get insurance. I think in 2017, nearly 31% of Americans were able to get health insurance that were uninsured, but what about those uninsured individuals as well? There's a lot of issues that need to be addressed. And in March of 2023, Senator Raphael Warnock introduced the S954, which is the Affordable Now Insulin Act of 2023. And basically this bill is proposing that there be no deductibles when it comes to insulin, no cost sharing, caps of $35 on vials of insulin, which would be fantastic because, like I said earlier, they could be nearly $300 a vial. And this bill also wants to focus on placing caps on different health insurance coverages, what they cover, what they don't, as well as percentage amounts on supplies that relate to insulin, like lancets or glucometers and things like that. Unfortunately, from 2017 to 2019, only 443 bills became law out of 10,000. So the legislation process is a little bit slow. I think there's nearly 500 members in the House of Representatives and nearly 400 individuals in the other body. So it is a little bit of a slow process when it comes to creating laws and bills, but hopefully Senator Warnock, as well as his team and the other regulatory bodies, can work on making this bill law. It might take a while, but I think that it can help a lot of Americans. And I'd actually had a patient not long ago that was talking about insulin affordability and how there are some places that have capped insulins, and it has been a godsend in terms of being able to regulate his diabetes. He said he was in and out of the hospital all the time because his blood sugars would get so high, and there was nothing that he could do about it because he couldn't afford his insulins. So I definitely feel for my diabetic patients, and this has been great because I've been able to learn about other resources that I can tell my patients about, and different programs that are available for discounts for insulins or insulin products. So if you guys have any other questions, you can email me at mpartyk1@dtcc.edu. Thank you.